Greetings to Connick and Green BRSU School Board members. My name is Brittany Dombrowski, and I'm a third grade teacher at Dorset this year. And I'm here representing the union as liaison to the Vermont NEA Healthcare Council. And as you're likely aware, negotiations over the next statewide health insurance agreement for Vermont's public school employees have been ongoing since April. I would like to take this opportunity to briefly address you about the status and potential impacts of these negotiations. The union believes that open communication between teachers, support staff, and members of the board is critical to ensuring affordable, accessible, high-quality health care for employees in this school district. As you know, health insurance for Vermont public school employees is bargained at the state level by a 10-person commission with 5 commissioners appointed by the Vermont School Board Association and 5 commissioners appointed by the unions representing public school employees. After some intensive negotiations at the end of June and mediation in early July, the two sides were not able to reach a settlement. A fact-finding hearing took place during the second week of August. If the parties do not reach a settlement before then, the process will move to a binding arbitration in November with an arbitration decision expected in December. The Vermont School Board Association's team, 2 members of which are not elected school board members, have proposed significant increases in the cost of health insurance for school employees, including quadrupling out-of-pocket costs for teachers and quintupling those same costs for support staff. The proposed increases would make healthcare much less affordable and accessible for teachers and support staff in our school district, particularly our lowest paid colleagues. Comprehensive, affordable, and accessible healthcare is one of the strongest recruitment tools to attract school employees, and moving in the opposite direction, as proposed by the Vermont School Board Association healthcare bargainers, will hamper our district's ability to attract and retain the best possible professionals for our students. Local school boards and local educators have a shared interest in a healthcare package that makes it easier to attract and retain the best talent, not one that drives people out of the profession. The Vermont School Board Association's bargaining team's proposals to make healthcare more expensive, harder to obtain, and more difficult to manage sends the wrong message to the dedicated educators and support staff in our district who are essential in providing an outstanding education during a pandemic. Local school boards worked hand in hand with school employees during this once-in-a-century public health crisis. The Vermont School Board Association's team's approach to healthcare is an insult to you as a local school board member and to the educators you employ. Please do not let their actions harm educators, support staff, and students in our district. The Vermont School Board Association's Board of Directors needs to hear from you, its constituents, about the impacts its proposals will have on our school district. We strongly encourage you to attend the regional Vermont School Board Association meeting on September 14th. It's on Zoom. It's 6 o'clock, I think, to ask questions of your representatives and to hold them accountable. Finally, the board and the association share an interest in achieving statewide healthcare reform, because that is the only true way that we will begin to clamp down on annual double-digit increases in the cost of private health insurance. While the Vermont School Board Association refuses to join Vermont NEA's call for systematic healthcare reform, educators and local school boards can make a difference by working with legislators and others in the coming weeks and months. We call on you to join us in supporting the work of our newly formed Legislative Joint Healthcare Affordability Study Commission to explore creative policy options for improving healthcare affordability statewide. Because when all Vermonters have access to affordable, equitable, and quality health care, boards and educators can devote all our energy to providing a world-class education for all students. Thank you for your time, and we look forward to continuing this important conversation.
Okay. So you're speaking for the group?
Yeah.
Okay. We appreciate your input.
Thank you.
And just as in interest of full disclosure, David and I are both on the VSBA board. So we kind of we're representing folks down here as well. So, okay.
Is it possible, I would like to ask a question, or is this inappropriate?
I think it's fine.
This is very helpful because we hear it from the other side, and we hear all the perspectives from the other side. And for the life of me, and maybe Jim as well, we couldn't figure out what the complaints were. So if I heard you correct, you speak very fast.
Sorry, I didn't know how much time I had.
You're pretty clear, but if I heard it correctly, the basic concern is that out-of-pocket expenses by this new proposal will be quadrupled.
Quadrupled for teachers and quintupled for paras, which will bring paras up to 18% of their wages they'd be spending on healthcare, and 10% is considered underinsured, so it's well above that number.
Okay.
Now that, when you, sorry, just when you say out of pocket, you know, there's premium and then there's, you know, out of pocket. You're looking at kind of, you know, all together?
Yeah, I think I'd have to actually have the document in front of me. I think it's looking, when you combine the two, it's 18% of their total wages.
Okay. Thanks.
Thank you.
Okay, we appreciate the input.